Hi everyone, my name is Sahil Parikh from University Irving Medical Center in New York City, and I'm excited to be talking to you about two important clinical trials here at TCT in the vascular domain. The first of which is the PEERLESS study. PEERLESS was a randomized controlled clinical trial in the study of pulmonary embolism treatment. It compared catheter-directed thrombolysis with TPA with various devices against large bore mechanical thrombectomy. That was specifically with the FlowTriever device, which is a 24 French large bore embolectomy catheter. The patients were randomized to either therapy and were assessed over a time course in the first 7 days for a variety of events. And the bottom line from the trial is that both study groups were treated with either or therapy and had excellent safety in what is what we would call moderate or intermediate high risk population. Patients with large pulmonary emboli with cardiopulmonary symptomatic symptoms and tachycardia, and it excluded those patients in shock and those patients with high bleeding risk. Safety was excellent. Patients were randomized 1-to-1, and there was very few bleeding events in both groups, surprisingly, and there was actually very little in the way of clinical deterioration, but there clearly was an imbalance of those who deteriorated. Those on the CDT group deteriorated more frequently than those in the large bore thrombectomy group. And not surprisingly, we saw that there was fewer days of ICU stay as well as hospital stay in those who got large bore thrombectomy. So using their primary endpoint that was a hierarchical win ratio approach, it was clear that there was a win for large bore thrombectomy over catheter-directed thrombolysis. The trial is important largely because it's the first large RCT in the space. It demonstrates that there's safety and efficacy of both technologies, catheter-directed thrombolytics as well as large bore thrombectomy. There was an advantage with respect to rapidity of improvement in secondary analyses of echocardiography and other metrics of RV performance. But at 30 days, both groups had excellent improvement in their RV function. And so, there is now clinical equipoise in terms of long-term or 30-day events, but in the short term, it seems that large bore thrombectomy gets patients better faster. And I think now with this prelude, there are a number of RCTs that we're looking forward to over the next several years that will really establish what's the proper algorithm for care of these patients, and should we be moving our guidelines to non-conservative therapies, in other words, away from just anticoagulation alone and moving towards some sort of catheter-directed therapy. I applaud the investigators and all the patients that were involved, because this is really the dawning of a new era. The second important trial of the vascular trials here at TCT was SIRONA. SIRONA was a randomized controlled trial comparing paclitaxel-coated drug-coated balloons versus sirolimus-coated drug-coated balloon in femoropopliteal disease. We've known historically that these drug-coated balloons with paclitaxel have important clinical efficacy and are better than angioplasty in terms of primary patency and freedom from clinically driven TLR. But the sirolimus balloons have never been randomized in a proper powered and core lab adjudicated clinical trial. And so we really had a lot of doubt whether there was a clinical effectiveness, because we've only had registry data and self-reported data. So here in this study conducted in Germany in an investigator-initiated trial, all-comer paclitaxel DCBs were compared to the Magic Touch sirolimus-coated balloon from Concept Medical. And in a 1-to-1 fashion were randomized over 400 patients. At 12 months, their primary patency was assessed with duplex ultrasound, which is our standard approach. And we saw that there was really equal numerical numbers, with non-inferiority being proven statistically between the primary patency of paclitaxel-coated balloons and sirolimus-coated balloons in relatively modest lesion lengths. It's the first data that really supports the clinical effectiveness of a sirolimus-coated balloon in peripheral artery disease intervention. It's the first randomized trial. And in fact, it's the model for which we'll be conducting a similar RCT for IDE purposes here with the FDA's approval in the United States. So the SIRONA trial, I think, is again another trial that sets the benchmark for what can be achieved with a different drug than paclitaxel in peripheral artery disease. I think that what will happen next is also going to be important for the coronary space and for the below-knee circulation. So again, this is an important trial as the first of, I think, many to follow.